So putting it all together, this is what it looks like. Of course, number one, check the scene for safety. Make sure you do that. Check for responsiveness by tapping the victim and saying, "Are you okay? Are you okay?" Shake and shout them on the shoulders. Shout for help. Find somebody. "Hey, you, call 911, get an AED." Check the victim for normal breathing and movement, so signs of life. So scanning at the top of their head for 3 seconds, scan the rest of their body for 3 to 4 seconds, and then scan the top of their head again for 3 seconds. If they do show signs of life, continue to monitor their breathing and check for any bleeding or medical IDs. Make sure that they are maintaining their breath. If they are not showing signs of life or unresponsive, start with compressions. So begin by placing the heel of your hand in the center of the chest. Remember, 1 or 2 hands. Pressing down 30 compressions, pace of 100 to 120 per minute. Followed by 2 breaths. So head tilt, chin lift, pinch the nose, big seal around your mouth, and breathe. 1 breath, 2 breaths. And after that, go back to the 30 compressions again. After the AED has arrived, you want to make sure that you go ahead and start using that. But we're going to get to how to use that in just a moment. But knowing that that is an important critical step as well to prolong a child's life, of course. And so you continue with 32 steps until the AED arrives that I just mentioned, or the EMTs or paramedics take over. Someone with more advanced training takes over, or the victim starts to show signs of life. So using the AED, I'm just going to run through these fairly quickly because it is pretty similar with the exception of a couple of things for the use of an AED on a child. So remember our acronym PPPCC stands for power, pad, plug, clear, and compressions. Everything else is the same except for pads and plug for the child. So the first P is, of course, power. You want to make sure that you push that power button on because, again, it actually walks you through the steps that you need to take for performing the AED. But it also needs to do a self-test and a self-check to make sure that it is in well-working order. So push power on first. There is also something that you want to look at, especially that if you work in a daycare or an area that surrounds children. Some of them have a specific component called a child cable key, and it basically is a colored key, usually pink or blue, that will actually minimize the shock for a child and actually kind of switches the amount. So it knows whether you're working with a child or working with an adult, and it modifies that based on if you put that key in. If the key is not there, then again it is fine to just use the normal shock for that particular child, but the voltage, again, it will be a little bit different. So if you can, or if there is one in your kit, make sure you use the child cable key to switch the voltage. The P in the second P, excuse me, is pads. So the pads on a child are actually a little bit different than an adult. So for the pads, they actually look different if you do have children's pads. They look like this. They're generally the same shape, but a different size, of course, than the adult pads to fit on a smaller body. And the pads also fit on the center of the chest and the back of the back, of course, as opposed to the adult where they're on the one side of the chest and then the bottom side as well. So they're a little bit different placement for the child based on where the heart is for that particular individual and the maximum effectiveness. So if you have children's pads, place them on the front and the back of the child. You may have to roll them over slightly to do that. However, if the child, remember, is ages 8 or older, they can actually use adult pads instead. Now, if children pads are not available, you can definitely use adult pads, and that would be just fine as well. Just follow the pictures of where the pads actually need to go, and then for a child, it would actually go ahead and place them in the same position where the adult pads actually go as well. However, one stipulation, if the pads for an adult are being used on a child and they actually touch one another, so if this pad touches this pad, then you want to go ahead and place this one on the middle of the chest and then this one, of course, on the back, because you cannot actually have the pads connecting or touching one another. So you may have to space them apart, again, one on the front and one on the back. Special situations for the pad placement. So again, you're not going to probably have too many of these. This not be a very common thing, but you want to make sure to check and see if the child does have a medication patch. Remember to put on your gloves, protective gloves, your personal protective equipment. Remove that medication patch and wipe the area clear with a towel or shirt or something. Very uncommon, but could happen. A child may have a pacemaker, and remember to look for that placement and to make sure you place the pads just an inch to an inch and a half away from that particular pacemaker. And then the other stipulation would be a wet chest. If they're in the pool, again, to pull them out, dry off the area where the pads are going to go to help with adhesion of the pads to the body. Of course, we're not going to have a hairy chest for a child 8 years and younger, so we don't have to worry about that stipulation. Now the plug, the other P, the third P in triple P double C is the actual plug. So the plug needs to actually again be pressed in. Once you put the pads on, plug it actually in. Now the children's pad's another way to identify them if you can't see the pictures for whatever reason. Usually the plug is kind of like a teddy bear style plug, and that will again identify them as children's pads. So go ahead and look for the plug and see if it is a teddy bear. Sometimes it's pink or blue, you know, kind of a childlike soft color. That would determine to use those pads instead of the adult pads. But anyway, once you plug it in, you put the pads on, you plug it in, you want to make sure that you are clearing the victim, again, so it is not detecting any movement or signs of life if you are in contact with the actual machine. And as I just mentioned, clear. Before you hit the shock button, make sure no one is touching the victim, and I want you to actually say the word clear in the skill checkoff to get familiar with that. So make sure no one's touching them and no one is around them. Finally, after the shock has happened, you want to go ahead and go right back into compressions. Start immediately, placing the heel of your hand in the center of the chest. Again, pressing down roughly about 2 inches or a third depth of the chest, using 1 or 2 hands and pressing at a rate of 100 to 100 beats per minute.